Buenos días, Carmencita.
Thank
Gracias,
you for your
gracias
time,
por tu
for
tiempo,
being
gracias
here.
por estar aquí.
I would like to
Quisiera tal
begin
vez
by getting
empezar
to know
para
you
conocerte
and
más,
how you got
saber un poco
connected
más de
with
ti.
Puente de Solidaridad.
Mi nombre es Carmen Salses Medina.
My name is
Soy
Carmen
trabajadora
Salses Medina.
social.
I am a social
Cursé
worker. I studied
la
this
profesión en
profession
la
at
Universidad
Universidad
Autónoma
Autónoma
Gabriel René
Gabriel
Moreno.
René Moreno. I believe we have a purpose in our lives.
Porque creo
Our
yo
lives are already
que
written
nuestra
for each
vida,
of us.
y creo que Dios guió mis
And I
pasos
think
a la
God
universidad.
guided my
Entonces eso
footsteps
me llena mucho
toward
de
Puente de
satisfacción,
Solidaridad.
mucho de
It fills
satisfacción
me with satisfaction to
poder
be
estar
here,
aquí,
to be able to
poder
fulfill myself
ejercer
as a
como
professional
profesional
and at the
y
same
a la
time
vez
as a human
como ser
being,
humano,
because the
porque el
work we
trabajo que
do
realizamos en
in
la
Puente de
fundación
Solidaridad benefits many
beneficia a
people
muchas
who need our
personas que
support,
necesitan de
who
nuestro
need
apoyo,
help,
necesitan de
and
una
sometimes
ayuda.
just guidance.
Feliz de
I am
estar
happy to be working here.
trabajando en la fundación.
Sí,
That is
sí,
very beautiful.
eso es muy lindo.
This role allows you as well to learn many lessons,
Permite muchos
aprendizajes.
aprendizajes, ¿no?
Maybe you can share some of
Tal
these.
vez, si puedes
What have you
compartir
learned
algunos
from
de
our
ellos,
patients?
¿qué has aprendido de nuestros pacientes?
Bueno, nuestros pacientes
Our patients arrive from different places, from Santa Cruz, from distant neighborhoods, from marginalized settlements, from provinces. They even come from other departments or states. They have many health needs. They suffer instability from not having stable jobs. I have learned many things from our patients. For example, our heart surgery program is the one that moves me the most, the one that touches my sensibilities, the deepest parts of me. I have learned from the mothers to persevere. I learn about how they are supported by their families, their communities, and their neighborhoods. I also see the strength with which they face the situations they are living.
Quería saber, tal vez
I wanted to know, in all this time that you have been working at Puente de Solidaridad, maybe there is a patient or patients or some characteristics of patients that have moved you or influenced you or impacted your work in a particular way. I wonder if you can share some of these stories.
Todos los pacientes de alguna
All our
manera
patients have marked my work in some way
marcado
at
mi
Puente de
trabajo en la
Solidaridad,
fundación,
both at the professional and
tanto en la
personal
parte
levels.
profesional como en la parte
I
humana,
especially remember two
pero
patients.
recuerdo en
One
especial a
was
dos
admitted for
pacientes,
general
por ejemplo,
surgery,
una paciente
Aurelia.
de misión
She had a
en
colostomy
cirugía
bag.
general.
In Bolivia,
En
there are many
Bolivia
people who suffer from Chagas
existen
disease.
muchas personas que
It
tienen
affects their
problemas de
heart and their
Chagas, de
intestines.
corazón y
She had a part of her
entonces ella
intestines
tenía
affected by
esta
Chagas.
parte del intestino que
In
no
Bolivia, it is
podía
very
funcionar.
hard to
En
have to
Bolivia
use a
es muy
colostomy
difícil
bag.
ser portador de
It's
colostomía
hard to get
tanto
supplies,
como
the
conseguir el
bags,
material,
and
la
the surgery is
receta
very
y
expensive and it's a
luego
complex
las
surgery.
cirugías que tienen costos elevados y
I remember that after the
recuerdo
patient had gone
cuando
in
el
the
paciente
operating
ingresó
room,
a
there
quirófano,
was some kind of problem.
el doctor Maguet,
Dr.
me recuerdo
Maged,
muy
I
bien
remember well,
que él
he
dijo,
said, "We are
vamos a
going to try
intentar
the surgery
nuevamente
again
mañana
tomorrow."
esta cirugía. Habló
He
con la
spoke with the
familia, con la
family,
paciente,
with the
ellos
patient,
estuvieron de
and they
acuerdo.
all
Me
agreed.
acuerdo, tengo
I
muy
remember vividly
presente
what
que
he
él
said.
dijo que se puso
He
a
meditated
meditar,
on what to do.
a
He
reflexionar,
asked himself,
¿qué
what
haría
would
él
I
si
do to
fuera un
solve the
familiar
problem
para
if
su
it were a
próxima
family
cirugía?
member? You
Entonces,
can see there the
ver la
warmth of the
calidad,
person,
calidez
his
de la
humanity,
persona
his
humana,
professionalism.
profesional, y
We
se
were
pudo
able to do the
realizar la
surgery the
cirugía al
next
día
day.
siguiente.
He was able to
Hizo
perform the
la
colostomy reversal.
corrección de colostomía.
The following
Luego me
year,
invitó
when
al año
Dr.
siguiente con
Maged came
familia.
back to Bolivia,
Hicimos una
we
visita,
visited
nos
the
invitó a
patient's
su
home.
casa la señora.
We
Estuvimos
went with
el
Dr.
doctor
Maged and all
Maguet
the
con
mission
todos los médicos
doctors to see her
y ver
happiness,
la alegría
to
de la
see her
persona,
healed,
verse sana,
fulfilled.
realizada. Entonces, son cosas que te marcan
Those are things
como
that move
profesional
you
y
as a
decís,
professional, and you
estás en
say
el
to
lugar
yourself,
correcto y
you are
haciendo
in
lo
the right
correcto.
place,
Entonces,
doing the right
tienes esa
thing.
satisfacción como persona y
You
como
have the
profesional
satisfaction as a
y ves la
person and as a
calidez humana
professional.
del
You
médico.
see the human
Entonces,
warmth of the doctor.
esas
Those are
cosas
the things
que
that
te
make you have
hacen
faith
tener fe,
and
esperanza
hope
en
that
que
something good may come out of this. I remember Juanita. When she was about 2 years old in 2008, Puente de Solidaridad supported her for her first heart surgery. Later, she developed more problems, and in 2018, she needed a new surgery. She came in search of support from our program. During the home visit, when the mother stepped out for a moment, I took the opportunity to talk to her. I asked her questions like, "How are you doing? What grade are you in?" I also asked her, "What would you like to do in the future?" She told me she wanted to study, to be a professional, in order to give her mother the house that they didn't have. All these things get you very emotional. They touch the deepest parts of you, because you see this and say, it could be my child here, with all the hopes and desires to be healthy, so she can later provide for her parents as they are doing for her. Those things move you a lot. I feel very privileged to be in the Fundación because I can be a better person every day through my job at Puente de Solidaridad. It is indescribable, the feelings, the emotions. It is very beautiful to be here.
It is a chain of solidarity. From the moment the person leaves their home in the rural areas to the moment they arrive at the Fundación at Puente, and how help and support continues all along the way.
It is a chain of help. When they arrive at the hospital, many times the doctors who know our work, they refer them to us so that we can help them. We have very committed doctors. They are our allies who also see the need. And if we can help their patients, they refer them to us. It is a chain of solidarity.
How beautiful and inspiring as well. Thank you very much. I don't know if there's anything you want to add that I did not ask you. Maybe you want to add something?
My hope is that there are always people who care, who are interested and concerned for other people, that what they do is part of a greater good for the people who need them. I am very grateful for everything, for the opportunity to be part of the Solidarity Bridge and Puente de Solidaridad family. In these times that we are living with the pandemic, of quarantine, to know that you are there, working, doing all that is necessary for us to keep helping the people who need it, that gives me hope. And it also gives me hope to know that we can rely on you.